morning to all the dignitaries and all the delegates. We will be having a lot of overlap in the first and the second session because the talks have been planned in such a way that the first two sessions set up the tone for the day. They serve as a primer so that we are equipped with the knowledge of all sorts of ocular diseases and how the basic management occurs. And the second part of the sessions, the second half of the sessions is specific for the industrial specialists so that you're able to use this knowledge in your daily practice and understand where to treat and when to refer. So I'll be speaking on common ocular diseases, a bird's eye view. So the most common problems that the people tend to have, we have already studied the anatomy and the vision charts have just been illustrated because these are basic vision charts which can be kept even in an industrial specialist chamber to find out whether the baseline vision of the worker who's working with you is fine or is he losing any sudden vision. So occupational eye disorders represent a complex group of traumatic injuries, harmful exposures, uncorrected and undiagnosed ocular errors or diseases, eye strain and fatigue, and miscellaneous ocular complaints. But the most common eye problems which come not only to a medical specialist but also to an ophthalmologist are refractive errors, lid and orbital infections and inflammatory disorders, ocular surface and corneal diseases, cataract, glaucoma, squint and ocular motility disorders, and retina, in which we tend to face retinal detachments, diabetic retinopathy, and age-related degenerations. So this is a very basic of refractive error. We all know that the ability of the eye for a perfect focus, has already been discussed by Dr. Charu, is disturbed in refractive error. So in myopia, the focus rather than being on the retina occurs before it. In hypermetropia, virtual images behind the eye is formed behind the eye. In astigmatism, there is no single focus of light, and that is why a blurred vision tends to occur. And presbyopia is a condition wherein there is a loss of accommodation or decrease in the accommodation and the lens's ability to change its shape with age, and hence we tend to get a reading number. These refractive errors can be managed either in a non-surgical form by the help of spectacles and contact lenses, or with a surgical method which can either be cornea related in the form of refractive surgery or LASIK, and others will include an implantable contact lens or even a refractive lens exchange. So the most common lid disorders which can even present to an industrial specialist, especially with the kind of, the scenario or the workplace where people are working, are blepharitis, wherein the patient can present with itching, burning and crusting and foreign body sensation. And simple treatments, even with diluted baby shampoos, artificial tears and erythromycin ointment once at night, can help the patient come up and decrease the difficulty of the patient and disturbance that he faces in his man hours during the workplace. Kilajon and stye is another common problem that you will also tend to face, and kilajon is a chronic inflammation of the meibomian gland which produces the oil, and stye is the suppurative inflammation of gland of Zeiss or mole. In kilajon, we do not tend to give too much of antibiotic because there's not much role in a chronic one, and eventually a surgery is only required. Whereas in stye, if the inflammation is tending to occur in a more fashion and it is converting into a preseptal cellulitis, it is rather better to treat with oral antibiotics early. Sometimes the inflammations can, enter inside the orbit and cause the inflammation of cellular and adipose tissue. This inflammation has a tendency to even go up to the brain and the cavernous sinus, through the cavernous sinus, and patient can present with marked proptosis, severe chemosis, edema and pain and fever. It's better to urgently refer these patients to not only an ophthalmologist but also super specialties wherein they can be admitted and IV drugs can be administered to them. Orbital trauma is another major concern which you tend to face. A wooden foreign body, an iron foreign body, a blowout fracture, a foreign body in the orbit. These issues tend to concern an industrial specialist. Now, the ocular surface in cornea has already been described by Dr. Charu. Because of the UV ray exposure, very commonly people will come to you with a red mass which is there on the nasal side. It's a triangular shaped growth of a conjunctival tissue and most commonly occurs by UV rays, dryness, and irritants like smoke and dust. The treatment is surgical in this modality. Conjunctivitis or pink eye or red eye will be discussed in detail, but can be viral, bacterial, allergic, chlamydial, herpetic, toxic. It's important to differentiate because the treatment can vary from one to the other, but the safest thing that an industrial specialist can do is at least start with antibiotics and some teardrops. Ocular surface can face foreign bodies and blunt injuries, hyphemas, and even a complete perforation wherein even the iridial tissue is tending to come out. Chemical injuries are also extremely common, and in India, lime burn is the main, chuna is the main culprit. 80% of chemical injuries tend to occur because of industrial or occupational exposure, and it's more common in males than females. Radiation injuries to the cornea in the form of epithelial keratitis can occur because of excess exposure to ultraviolet radiations, infrared rays in minors, and excess heat, electricity, welding arch injuries can also tend to occur on the cornea. In infective pathologies, corneal ulcers and abscesses, it is rather better to send the patient early to the ophthalmologist because these are the conditions which can eventually lead to loss of the eye or loss of complete vision, and it can extend into the complete eye. The new menace, because we are all working a lot on the system, a lot on the computer and phone now, is digital eye strain or computer vision syndrome. You can at least counsel the patients to follow the ergonomic changes that they should make to their lifestyle in terms of maintaining distance from the system, using the 20-20-20 rule wherein they have to spend less time on the computers, take a break every 20 minutes, blink 20 times and close their eyes for 20 seconds. The next common issue that comes to us is cataract. Cataract, as Dr. Charu described, is this change in the lens. It will be discussed in detail by Dr. Kea also. So the protein fibers in the lens tend to become hard and lose their transparency with age, which gives rise to a cataract. The cataract tends to scatter the light, and the cloudier the lens gets, the more the light gets scattered. So the people who have cataract tend to have difficulty in seeing near objects, distance objects, recognizing faces, and face glare, and then tend to have difficulty in driving at night. Cataract, as you can see on the right eye, the normal vision, whereas on the left side, everything appears blurred as if you're looking through a cloud. So almost everybody gets a cataract, but in younger people, it can occur because of injuries, sunlight, metabolic changes, or drugs. And as you can see in the highlighted ones in industries, excess exposure to UV light, trauma, radiation exposure, or electrical burns can give rise to early cataracts. So detecting a cataract is by visual acuity, by a slit lamp examination and seeing if the patient is tending to have glare. This is very important for truck drivers because they drive at night and they can tend to face a lot of glare, and accidents can occur because of that. So the treatment of a cataract is a by decision between a doctor and a patient in terms of the vision impairment and in terms of the quality which has been disturbed in life. And the only treatment is a cataract surgery. There is no medication which can stop cataract. There is no medication which can decrease cataract. Glaucoma is another common ocular disease, but it is the most underdiagnosed disease. As Dr. Charu discussed, the normal flow of fluid inside the eye tends to get disturbed, which causes pressure on the entire nerve fiber. And these nerve fibers, which are carrying all the signals from the eye, thereafter tend to lose their own ability and health, and which increases the cupping inside the eye and decreases the visual field. So if you see here a normal person on the left, you can see absolutely normally. However, in the patient with glaucoma, the peripheral vision or the field of the vision tends to get constricted with time. So we do an extensive workup for glaucoma as discussed by Dr. Swati also, and we have Center for Sight is house of all possible diagnostic whatever you can think, we tend to have all the technologies available with us, and we tend to do a very extensive workup for glaucoma and thereafter decide, because the decision once taken has to be for a lifetime. Squint and neuro-ophthalmology, as discussed by Dr. Swati, is another super specialty. As an industrial specialist, you can face patients who have developed an acute trauma, a diplopia, a doubling of vision which they are facing, and this can cause accidents, this can cause loss of man hours and injuries at the workplace. So in cases of trauma, it can even lead to optic nerve avulsions, transections, hemorrhages on the optic nerve sheath. The bleeding can occur into the orbit and even give rise to air cells formation in the orbit. Finally, the retina. The diseases of retina can be myriad. They can be in the form of degenerations or vasculopathies. Degenerations like holes and detachments are generally associated with people who are wearing very thick glasses or myopic patients. Retinal hemorrhages are very common in patients with diabetics, hypertensive, or even trauma which has occurred to head or to the eye. So in a patient with diabetic retinopathy, as you can see on the right, the vision becomes blotched in nature rather than a perfect or clear image. So the patients in a diabetic patient, these symptoms, or rather the retinal findings, can vary from a small few hemorrhages to complete bleeding inside the eye, from non-proliferative to a proliferative damage. And age-related degeneration, especially in older people, can also tend to affect the main part of the vision or the macula, for which now treatments are available. Once there was no treatment for the same. However, now in the form of injections, there is a lot of hope still available for patients with degenerations. We have extensive workup facilities available for retina as well. So these were the common presentations we face, and this chart shall be helpful in finding, for a general practitioner, for an industrial specialist, as to diagnose the patient there and decide as to when can I, where my limit ends, and when can I treat and when can I refer. That's all, and thank you very much.